Hi everyone, my name is Dr. Tony Maglione and today I'm going to do a lecture on coronavirus, and specifically it's on public health aspects of coronavirus and the effects on politics and the economy, both here and throughout the world. And this is a lecture that's going to be about 45 minutes, should be a little bit under, and can be listened to by everybody, but more specifically to a college audience. And we're going to do it as a lecture specifically relating to public health and political science, so that we're going to be covering how public health affects the different nations and how they react to a new situation, such as the coronavirus. We're going to go over what coronavirus is. We're going to go into the effects of how each acted and what happened with their reaction and what were the consequences, some of which were intended and some were unintended consequences. We're going to connect all the dots and give you data that you've not heard so that you can understand that there's been a major overreaction because we have a problem with messaging. And the reasons we have a problem with messaging is most of the people in public health have been working for the government or in a government position for 30, 40, 50 years. And they're only good to see it from one perspective. They don't look at it from the whole. And when you get more data and get the whole perspective and context of what's going on, you'll learn to understand how a nation should respond, both on the federal level or state level, local level, and you'll see some of the differences between nations and what was done right and what has been done incorrectly, and how we should do it better in the future. When you understand that and connect those dots, you'll end up being able, by the end of this lecture, to understand the most important thing is learning how to think, how to take data, put it together, connect the dots, and then make better decisions that affect public health decisions that end up saving more lives and causing less harm. And that's not just in terms of the health, but also in terms of the unintended consequences, such as economic, social changes, effects on worship and religion, effects on individual rights. So that's what we're going to accomplish today. It seems like a lot of material, but it can be summed up. And as I tell everybody, I'm a physician for 40 years, been a cardiologist, and I've done social media. I've been on the radio for over 10 years doing podcasts and talks, and I've taught medical students and nurse practitioners, PAs, and residents for a long, long time. This is the first time I've done it with this particular structure, so if there are any technical problems, I apologize in advance. So let's go right into it for now, and let's hope we can get our mission accomplished by the end. And by the way, anything that you think is not accurate, go check it out. I'm not here to tell you how to think. I want you to know how to think for yourself. And you can't do that without understanding what things are being told to you may be factual or not. And that's why it's good to look this stuff up. You know, I've had 40 years experience as a physician, but I had to look up data for the numbers that I'm going to be talking about today. And it only took a few hours. The research is a lot quicker now that we have access to the internet. So let's get to the basics of coronavirus. It's a virus. There are hundreds of thousands of viruses. We as humans, we're a host. If a particular virus is going to do us damage, we must have some alteration of our host status that isn't working well, that doesn't defend itself well. And so different viruses that cause damage, like the flu and other pandemics in the past or epidemics, they are just simply situations that occur within a nation, an epidemic that becomes involving many, many nations. You have what's called a pandemic. And we could learn about how to deal with it because there have been pandemics now for over 100 years, and we have a lot of examples and a lot of numbers. We don't have to wait for new numbers to come to new conclusions. Now, this coronavirus, as I was saying, is basically a virus. It has been around for a while. It's been around for almost 20 years. China has noticed it in their country on 2 occasions. And what's happened recently, just like a lot of viruses do, they change, they mutate, and a new strand comes up, and this strand turned out to be more dangerous, more virulent. And it was virulent and dangerous in the sense that if it got on you, into your system, you ended up having a better chance of getting sick if you had immunological problems. In other words, if your resistance is down. And we noticed very early in China that it ended up hurting people who had one of several conditions. When you're old, your defense mechanism goes down. Your immunity goes down. When you've got cancer or undergoing cancer therapy, your immunity goes down. When you've got certain autoimmune illnesses, such as lupus or rheumatoid arthritis, your immunity system is down. If you've got lung disease, because this thing, primary target is within the lining inside your lungs, and that's how it affects most people who have COPD or emphysema. And we know if you have heart disease, especially with heart failure, which also affects your lungs, you're at an increased risk. So just to let you know some of the facts that they're not telling you, they tell you it doesn't affect healthy people that much, and that's true. Basically, if you're under 60 years of age, do not have any of the conditions I just talked about, the chances of you dying from this is very, very, very low. It's maybe 1 in 10,000. It's very low. There are going to be some people that do die because sometimes genetically we can't respond to certain viruses, and we don't know it until that virus hits. And that's why you see some people who are healthy getting very sick and dying that are young and healthy. So that's a problem. But it's not as much of a problem when you put it in the proper context, such as the flu, or what we call swine flu that we've had for 10 years. That ends up affecting younger people much, much more. And I'm going to get to the history of coronavirus in a second, but I'm going to give you an example of putting things in proper perspective and proper context by knowing certain facts. You see, we know that the flu ends up killing about 100 people a day. And in prime season, it can be up to 200 people a day. We don't have changes in the stock market. We're not changing our social behavior because of those deaths a day. And it ends up killing a higher percentage of people who are healthy under 60. In fact, it kills 1 to 2% of the deaths that occur in people under 4 years of age. This is the swine flu, not the coronavirus. The coronavirus kills much, much less than 1% of people who are young and healthy. So that's, and we're talking about under 60 years of age, not under 4. So the regular flu is actually more of a killer to healthy people. So there's been a total overreaction and lack of messaging to let people know and reassure them. And I'll go into the strategies of what's being done here in just a couple of minutes and how some of them are correct and some of them are an overreaction and in some cases an underreaction. So we'll get into that. Now the coronavirus, before 2019, I think I said that it was in China. It changed. It ended up affecting China in 2019 in December. And as we know, and we can't verify it, but as some of the people have written about in China, there was what we call a wet market where exotic meats and fishes, where people come and buy. And see, these viruses were going animal to animal. It is only this new strain of this virus that had to have been mutated that caused it to end up going to a human. And in that wet market, we got our first cases in the middle of December where people got very sick. And the Chinese government and the public health department in China, because basically they're part of the government, the communist government in China, it's a dictatorial government, and they have control over their people. There isn't as much freedom, obviously, as there is here in the United States. But they kept it quiet. What were their motivations to keep it quiet? We'll go into that in just a second. But the main thing that you need to know is China always is motivated by an ability to eventually get more power and control over the rest of the world. And how do they do that? They need to have money. They incorporated capitalism several decades ago because they knew to get power, they couldn't do it militarily. They had to become strong financially. And that's why they introduced capitalism. And they can win with capitalism and obtain great riches because they have very cheap labor. They force their people to work very cheap. And because of the demand for cheap labor and cheap goods throughout the world, they've thrived economically. So they didn't want to close down just because a virus was spreading. And in the province that it spread, they didn't close it down for over 4 weeks. Over 5 million people traveled through there, and a good percentage of them went and traveled to other countries, including Europe and the West Coast. And we know that because people, at the end of December, there's a break. Some of these people were tourists. Some of these people were students that went back to China, caught it as a carrier, and came back to the United States or came back to Europe. And that's why we know there was a spread. So the history is there. We know that when it hit Europe, the country that it hit the worst was Italy. And why did it hit Italy the worst? Well, they have a socialized medicine system, and they have a globalist type leadership that is very disorganized. They're not prepared. Preparedness is very important in terms of public health. You have to prepare. We have an example here in New York State where Governor Cuomo in 2015 was advised to prepare for pandemics. We knew about the swine flu in 2010, and when he was governor, he was advised. He used that money to set up a lottery system for solar energy and to give perks to a lot of his friends that were donors, and he ignored that. In fact, he actually had a death panel that he spent the money on in case there was a problem, rather than prepare with equipment, supplies, ventilators, masks, and all the things, and gowns, and all the things that are necessary if there is a pandemic. Well, Italy had also no preparedness because they run on a socialist system in terms of their health care, and their public leadership are not very good at giving advice, and they're not getting at connecting the dots, getting good at connecting the dots to be able to warn people. They did not shut down their borders early enough, as the United States did, as President Trump did with China. And as soon as we found out we were getting cases from Europe, we shut it down from Europe. Because the best thing that was done, and that saved in the United States probably tens of thousands of lives, is to keep people who had the virus from coming in. Because if too many people come in, it'll spread more. Despite our social distancing and hand washing and all the things that have been closed, it will spread because of the sheer numbers. So you had to decrease the numbers. Italy did not do that, and so they got caught. And also they weren't prepared, so they didn't have enough equipment. And they got caught in a situation that once it was in a certain province, like for instance, like a state in the United States, they didn't get help from other states or other provinces. So they closed it in. So when it was in only 3 provinces in Italy, when it was the majority of the cases were just located in just a few localities, a few provinces, they got overwhelmed. And certain hospitals got overwhelmed, and the healthcare workers got overwhelmed. And even if they had good immunity, just the sheer exposure to the number of cases, some of them got a bad case of the virus, their immune system got knocked down, and there's been a few deaths with healthcare workers, healthy healthcare workers. So we know that without preparation, there's going to be casualties, unintended consequences, where you're not just having more deaths because of the virus, you end up having more deaths to the people actually taking care. And when the people taking care are dying, that there is less people to take care of the other people who have the virus and are ill. But I'm optimistic in this country because we actually have now a good plan. The president did a good plan with the travel restrictions and started a good plan by incorporating something that is very important that Italy couldn't do, that China couldn't do, because they're controlled by their government and their socialist type system, especially involving their health care. The United States is able to take care of the problem by using the private sector. We now know the public sector, the governor of New York, he didn't even know that he had stores of supplies, including masks and gowns and ventilators. He was complaining he needed more, and he didn't, again, he wasn't prepared. There was a 2015, there was a recommendations for ventilators and gowns and masks to prepare for a pandemic. So when you do that, you're trying to catch up, and that's the worst way to take care of a problem. And so the United States federally is dealing with it correctly. The major problem I said before was messaging. I'm optimistic because I think eventually the message is starting to get out there. I mean, 6 weeks ago, I was saying these things, and now I think it's starting to get out there more and more, where there is a perspective. When 100 or 200 people are dying today of the regular flu and we're not doing anything about it, to change our economy, to close borders, or to do social distancing, and to close restaurants and all the things that have been done, to close schools, just like we're doing now, to try to do an online course. We know that when you start going in that direction, you're going to have certain consequences. You may decrease the amount of people who spread it to one another and may decrease the deaths. The question is, what is acceptable? The one thing that we've learned, that if we respond too much by closing down too many of our daily activities, like no more than 10 people in an area, you end up restricting some of our constitutional rights and freedoms. In China, it was easy. They don't care. There is no constitutional rights for the individual there. As soon as they decided to do something, a month later, they basically stopped anybody from traveling from one place to another, and they closed down that whole province where it initiated. And so all these people were totally stuck staying at home. They had the police out there, and they did that in such a way so that they can control it. And, within 3 months, everything was controlled. But they had to go through drastic measures when they made a mistake initially. They wouldn't have had to do that to that degree if they had acknowledged it early and had stopped the spread throughout the world. They would have contained it within their province, and they probably would have had only a quarter of the amount of illness and casualties. You see, the Chinese actually had this virus before. In January of 2019, there were scientists just out of this province where it started, in Wuhan province. They actually had scientists in 2019, January, 10 months before it propped up, saying that we already had coronavirus. They needed to do work on it, to develop a vaccine, to get some people to get at least immunity, so that if it does change and mutate, which many of them do, most people would have had partial immunity, and there would have been a vaccine available so that it would have blunted the response that now probably some medicines will do now here in the United States. But that would have been preparing and having good public health policy. China did not do that. So they fail, other than their overreaction at the end, containing people and not giving individual rights to anybody and totally quarantining everybody. Italy started the social separation and distancing too late, because Italy is a social country. People get together, they get together in crowds, and so it spread too much. There was too little too late, and so they're suffering the consequences of their failures, of their public health system and their strategy. But here in the United States, we've done well, except for certain places that were unprepared, like New York, and other places. And New York can't be blamed totally on its leadership, on the mayor and on the governor. They're heavily populated, and they get a lot of tourists, and they get a lot of people from other countries. So they're going to be at risk, just like bigger cities in California and Washington State, Seattle, places like Las Vegas that has a lot of foreigners, or people like in the South, such where Mardi Gras was in New Orleans. They're going to be at risk because they did not close down Mardi Gras, and there were a lot of people who probably were carriers that ended up developing the sickness. By the way, just for your own sake, the sickness will cause people to get a little bit of a sore throat initially in many cases. Sometimes if it affects your GI tract, you'll have a little diarrhea. You may have a different sensation in smell or taste. And that's how it usually begins, but it takes about 7-10 days of carrying it before you get to that point. And in some cases, it's actually been a little more than 2 weeks. Then you have about 2 or 3 days of those symptoms. And then for many people who have more than just mild symptoms, 80% of people will just have mild symptoms who get this virus. But for a few people who are more immunosuppressed, who have less good immunity, like the elderly, they will then get fever, get a dry cough, not a wet cough, a dry cough. And they can then get pneumonia. It'll go into your lungs. And if you get pneumonia and you don't recover from it and it gets stronger, you get a shock lung, something called ARDS, and you can die. So it's important for us to learn how to social distance properly without interfering with one's individual rights. And what's happened in many states, they're quarantining the whole state. They're causing all businesses to shut down. When we know that the people in this country, even if they got the virus, nothing's going to happen. In other words, the flu is more dangerous to them. Again, proper context and perspective. To have the right perspective, you have to have data. We know the flu, I said, causes 100 deaths a day on the average. Some years, just the previous year, 2018-19, the flu seasonally had a regular 35.5 million people got it. There were almost 500,000 people hospitalized, over 34,000 deaths. A bad year, 2017-18, we had about 80,000 deaths. And we know that the first year it happened with Obama, and Obamacare was being passed, so it was kind of ignored by the press. So we know the press had something to do this time with creating panic and fear, because the press at that time, the swine flu, when it first occurred, we actually had about 59 million people affected over the course of the season, and we had about 12,000 deaths. 12,000. We have now just a little over 1,000 deaths, and we have, and probably will get maybe close to that number. But because this particular year has a low flu problem, the combination of this year's flu deaths plus the coronavirus may actually be like other years, the average for other years. So the other years, nothing happened. And when the swine flu occurred in 2009-10, there was no change in the stock market. We didn't have a 37% change. I'm going to show a slide of that here in a few minutes. So we know that if the right perspective is that something is different. Well, what we know is different is the press has been alarming people, mostly with fake information, for the last 3 years with this president. And when they saw this virus hitting, they were hoping that Trump failed and many people would die and a lot of people would get it. And they also do it because if they get people fearful of anything, just like they do with climate change and other things, they'll let you listen to it. They'll give you false information and make you believe things through sheer fear, make you listen. They'll have higher ratings. So they have their own perspective, just like China has a perspective to keep the factories open and keep it quiet for a month. Everybody's got their own perspective to lie, to say things that are untrue because they have a different motive. They may not even know they're lying. They may not even know their motives are bad. They may not even know they're acting in highly unethical ways. But then, because of this panic, which as I said, I'm optimistic that when we start to learn that this is a big overreaction, 85% of the people weren't in danger. And the only people in danger were the population that I told you about. That's less than 15%, less than 1 out of 7 people were in danger to be what I would have called an intermediate risk or a high risk. 85% of the people in this country are at a low risk. And that means that you would not be in danger. And so from a public health point of view, you have to understand you can't shut down business 100% like it's been done in about 14, 15 states, including now North Carolina, is now going to be making people for 30 days stay at home, except for essential things, going to the pharmacy or going to a store to get food. Only healthcare workers and some other businesses are going to be allowed to operate. It's a complete violation of our individual rights. Some places, they close the gun stores. You can't even purchase guns against our Second Amendment rights. It's against assembly of 10 people. Now, I understand you don't want to spread it, but our assembly rights are constitutional. There's been no other situation where it's been taken away other than this in our history. Even during war, people had the right to assemble, had the right to buy guns, and the right to worship. They basically closed churches because you can't have more than 10 people. They got to do it online with less than 10 people to have a church service. You can't even worship. So they're taking away our rights. And is the healthcare need necessary and severe enough to do that? I would contend no, because we didn't do it with the flu. That is killing 85% of the people before, much more than this thing is. In other words, 85% of the Americans that are under a certain age and do not have immunological problems and do not have cancer and do not have heart failure or COPD or emphysema or autoimmune disorders, all of us would not die from this disease except with rare exceptions. And I'll give you some data. In just a few years ago, 2017-18, they looked at the data for young people, and about 1 to 2% of young people under 4 died, and a certain percentage under 25 died. That is about 10 times greater to 100 times greater that is dying now from the coronavirus. 10 to 100 times. It's ridiculous. And look at some of the data that's out there that is totally hyping this up. You have epidemiologists from Europe, similar to people who hyped up and gave false information about climate change data. Because there is data. We can make conclusions, but there's political ideology as to why people constantly try to tell you a falsehood in order to make you give in, not look it up yourself, not learn how to interpret the data. So you accept what they say because they've got ulterior motives, and some of that has to do with globalization and a few elite controlling the rest of people. It's about power and control, and money is one of the ways to get it. Brainwashing is another way. Dumbing people down by not allowing them or giving them the tools to learn how to think. Because these epidemiologists in Europe, they predicted the United States would have over 2 million deaths. 2 million deaths. And then they said, that's this year. And then after, and this is a month ago, just recently they changed it to now about 80,000 deaths. We're not going to get 80,000 deaths from this. We've had 80,000 deaths in a year from the regular flu, and nobody panicked. So even if we did, it wouldn't be any worse than one of our worst years in 2017 and 2018 from the regular flu that was seasonally there during the winter. So we actually had that case scenario, but it's probably going to be, less than half of that, or maybe a quarter of that. So it's not going to be as bad. Their mistakes of going from 2 million just to 80,000, they're 2,500% off. And I'm going to tell you, as a medical person and understanding scientific method, remember, when you talk about political science, the science is what's important. If you're going to understand politics and how a nation does things, whether they're to the left or whether they're in the middle, you're going to understand that the politics is only framed by what the science is, what the facts are. The politics can change the facts, but you're not getting the facts. They have to actually alter the facts and lie. So when you have actual facts, you will know that when you have 5% change in giving a theory, you're actually within the standard deviation of acceptance of scientific method to actually give validity to the comment. So in other words, if a person says 2 million and it ends up being 1.9 million die, well, okay, they're pretty good. They're accurate. But when it's 80,000 or less, they're 2,500% off. They're so wrong that either they're completely incompetent, or they're just outward lying, or they're alarmist and they've got another agenda. You have to ask yourself questions. When you think for public health, you have to ask questions. So when you make recommendations about social distancing and who has to stay home, it should be localized and it should be dependent on where the cases are. And the most important thing would have been, has been done. We've kept countries from coming into us. The other thing that needs to be done, you keep cities that have a higher percentage of cases from going out. You close off those cities. Those people can't leave. That's where it should be done. And we have probably less than 100 cities or less than 100 counties that actually are affected to any degree of significance. We have over 3,000 counties in this. And so when you have 3,000 counties in this country, when you only have 100 of them where they're heavily populated, that's where you're going to have the problems. That's where you have to concentrate your isolation and some of the restrictions. But we didn't have to do it for 6/7 of the population. The healthy people could have went about their business. Sure, if you could do studies online from home, that's great. If you can do takeout and businesses can't lose, restaurants can't lose their business, that's great. You got to cut down on travel. That's important. But the idea of cutting everything out and doing it statewide, like it's being done here in North Carolina under Governor Cooper, is wrong. Only the Raleigh area and the Charlotte area are the most at risk. So each place should do their own assessment, and the public health decisions, there should be recommendations from the federal level that it should be done locally from case to case. The guidelines for doing social distancing and more people working from home and traveling less should be there. And there should be some restrictions of travel from county to county that have higher cases. But the other ones, for 6/7, for 85% of the people, there should not be as much loss of freedoms. Now, what are the risks of these responses? Well, if we do nothing, obviously there'll be more illness. It'll spread. But if we do something too much, we end up having financial losses. Businesses close down. As I said before, you lose freedom. These are unintended consequences that have happened for the first time in our country. And they need to be understood. For you young people, this is dangerous, because when the government gets bigger, they get in the habit of doing things more and more. They don't take it away. And I'm going to tell you, you're young. The people that are listening that are college students, if you think that after you finish college, you're going to go home and listen to your parents and let your parents dominate the rest of your lives and make decisions for you and tell you when you can stay home and when you can leave, that's what you do when you let government get bigger, because they want more and more control over you. They use any excuse. They don't let any crisis go to waste. That is the left. And they will use that to impinge upon your freedoms. This should be a lesson. And hopefully it's being talked about, but not enough. The benefits of doing something, yes, we can get less deaths, less hospitalization, less spread by doing these things. But we can still get less death because we have a public and private sector that have allowed the public sector that failed in terms of preparing for this and fill in the gaps of getting the ventilators, the gowns, the masks that were necessary. And we have enough people that if we move some people around, we're going to be armed well enough. There's going to be some places where it doesn't work, where they were ill-prepared. New York State is one of them. But we also now have some treatments with the hydroxychloroquine and the Zitromax, and we have plasma that we can actually use from people that have been healed and have already contacted the virus and recovered. We actually can take care now of the sicker people. And if we do it soon enough with specific instructions, we can actually decrease death now without impinging on people's freedoms. I think if we do things in a overreactive way, in a panic way, because that panic started with the press. It didn't happen in 2010 with Obama. He was passing Obamacare. They ignored it. They didn't say that He failed by causing a 6-month delay, 12,000 people died, 50 million Americans got that virus. Not a word from the press. The press jumped on this, made it the biggest issue in the world. The market tanked 37%. Businesses, individual workers, you've got another 3 million people just for the first time in American history. 3 million people asking for unemployment in a 1-week span. And we're gonna have more and more as these next 7 to 8 weeks go by in April and May, because people are not reacting correctly. The public health response is not being appropriate. They're not telling you this is fairly optimistic. This isn't as bad as the regular flu. And I'm going to give you a little more perspective here on the next few slides. Look, only AIDS was there over a 20% response in the market dropping. And we have 32 million people that died from this. We're not going to get that. Throughout the world, we're not going to get that type of response from coronavirus, because we're going to have treatment for it, number one, and we're going to have vaccine by the next cycle. And so it'll be cut down tremendously. Although, I got to say, we only about half the people use the flu, which is why we still get 36,000 deaths a year on the average from the regular flu, from the swine flu and other flus. We get 36,000 deaths a year, 100 a day. We haven't had 100 a day so far of this. We've had about 60 to 70 days of this, and we've got less than, a little over 1,000 deaths. So obviously we're not getting enough there to make it even close to being as bad as the regular flu. And just look here, the swine flu under Obama, 0 change in the stock market. The press was totally quiet about it, totally quiet. Other cases, you can get like usually 2 to 5, 6%. That's what this should have been if it was put in its proper perspective. The panic is what caused the market to go down. And again, there's some panic about beds, and especially in New York State. We have over 6,000 hospitals in this country. We have almost 1 million beds. We get over 100,000 people admitted to the hospital every day. 100,000. Okay? That's throughout the entire country. We haven't even had 100,000 cases in the first 2 months of this. And we probably got about another 2 months where we're going to get it. And we're probably going to have about 400,000 or maybe a couple of million people who get it as well. But we're not going to have a problem taking care of people except in isolated areas that are ill prepared. Now, New York's getting help from the federal government. They're getting some hospitals, and they're getting some more beds, and they're going to be helped. But they were not prepared. But both Mayor de Blasio and Governor Cuomo did not prepare for a pandemic. And so they're now reacting after the fact and trying to make up for it. And who do they hurt besides creating more spread and death within their own state and city? They end up hurting the healthcare workers. They're going to be in small areas, in pockets, like Elmhurst Hospital. A lot of them the healthcare workers are going to be exposed to a lot of cases. And a lot of them are going to get sick, because we know that's what happened in Italy. So it's a tragedy. It's a tragedy, but you can't make excuses that you need something when you didn't prepare for it. You have to expect that outcome. Again, public health is important by telling people how to prepare, because guess what? We're going to get another pandemic. We don't know if it's going to happen in a couple of years, 10, 20 years, but it's going to happen. And if we're ill prepared, more people are going to die. Some perspective, again, in a 12-month period, swine flu, you get, over the last 10 years, you get 25, 30, up to 80 million people who have the infection in this country. We've only got about 110 in the first 2 months. And like I said, we may have a few million when all is said and done by this summer. And we may have more thousands of people dying. But it's not going to be as bad as the regular flu. That's why I said, in perspective, this is a tremendous overreaction, because it's unknown in terms of how it's going to happen. And that's what was being pushed. But we actually do know. We just don't know the exact number, but we do know from knowing what's happened over the last 100 years what to do. We know every day 100 people die from motor vehicle accidents, 100 people die from the flu. Do we stop driving because 100 people die from motor vehicle accidents? You have a much higher rate of younger people dying than the coronavirus will kill. Same thing with opioids, drugs. 100 people dying a day in this country. We don't do a thing about it. We do a little dressing on the side, but we don't really address it. And our stock market doesn't change because we've accepted that reality of death. By the way, we get 20 a day of veterans committing suicide every day. That's about what we have now, dying of the coronavirus. Nothing's being done with the veterans. Only some window dressing on the side. There isn't the panic and fear because the press isn't pushing that. They're accepting that. To put it in perspective, before I finish up, is that the States has over 7,000 people dying every day. The majority of them are old people. The majority of people who die in the United States are around 80 years of age. So we have 4,000 or 5,000 people every day dying around that age group in the United States. We've got about 20 dying from the coronavirus. If it peaks, we'll get 100 to 200 dying a day. But it certainly isn't 7,000 a day. And so that perspective and context makes you understand that there's been a complete overreaction. These public health decisions, this lack of preparedness, have consequences besides them dealing with the health. Because I think now we have the health problem. We're ready. We're going to have enough gowns because the private sector has stepped in. What a great country where people have done that. If we didn't have a private sector, like Italy, Spain, and to a degree, and China, that doesn't have really a private sector that can, because the government controls everything, there's much more devastation. It's worse. So everything has consequences, and we must understand that countries, if they're not prepared, or if their government is more to the left, they're not going to do the right thing because they've got different motives. And the motives are either a globalist mentality, a one world order type thing that a lot of European countries have, or socialism or communism, such as you have in China with the communism. They're going to have a dictatorial, tyrannical type of control over people. You lose they've already lost their liberties. We here are a free nation. We shouldn't be losing our liberties. The unintended consequences have been devastating. And it's given politicians, especially those to the left, because the people enforcing the governors, they're all Democrats, that are keeping the whole state at a forced lockdown, a forced quarantine. It's terrible. It's ridiculous. It doesn't need to be that way. Like I said, it should be done locally. It should be concentrated in the heavier populated areas. That's how you solve the problem. So what I did today was try to connect the dots for everybody, to try to give you information to think, look stuff up. But relatively, in terms of death, the average death in the United States is 79 years old, the average age. The average death is going to be 80 so far that we know. It may come down, but it's about the same. We're emphasizing the death, which is affecting really the sickest 15% of our population. Old people who are disabled or have several problems, or younger people who have the kind of conditions we mentioned before. So we need to put in perspective and understand that if we are to go forward and have success in the future, for all the young people listening, you've got to be able to connect the dots and understand the reality, the truth, the scientific facts that are there before us that tell us that in the right perspective and context, this was unknown in one sense, but we knew enough about pandemics that it was not as bad as they made it out to be. There must have been other motives. We know the press and the left hate Trump, so they used it as a propaganda tool. It ended up hurting us economically, which hurt the rest of the world, because when we're hurt, they're also hurt. So, to finally conclude, please do not listen to everything is said, especially by certain politicians and the press, and go and learn how to think for yourself. If you can do that, you're going to become not just a better person, but a better citizen. You're going to be able to be more successful and make better decisions and judgments in your life, and provide better for yourself, your family, and your community. So if you have any questions, my email is drtonymag, drtonymag @gmail.com. And my website is drtonymag, drtonymag.com. And I've got several books. I got one coming out. And I hope you enjoyed this. And everybody take care and be safe and take care.